Hello, my name is Renee Carell. I am 56 years old. I'm from Arkansas in the United States. I used to be a runner, and I ran a minimum of 8 kilometers every day, and I was a half marathon runner and multiple 5K runs. And about 15 years ago, my knees started hurting. And because we were self-employed, I did not go to a doctor. We didn't have insurance. And I just thought maybe my knees would get better if I slowed down for a while. They didn't get better, they got worse. And it became to the point that 4 years ago I stopped teaching because it hurt to be on my knees or my feet all day long, and climbing the stairs to and from my classroom was more than I could handle. In the past 4 years, it's been almost unbearable. I took the maximum amount allowed of naproxen every day, and it just barely took the edge off the pain. And I just couldn't get through my day. I wasn't able to do my household chores. Cooking had to be done from a chair. And I basically sat in my chair or laid in the bed and went back and forth from one to the other. When I did shopping, I had to do it from a wheelchair. And so finally, I decided with my children's help that I needed to do something to get my life back because I'm too young to give up. So that's where we started. Being able to get through the day. The challenge, not only the pain and the challenge of being able to get through the day, but the challenge was also our finances. We are not self-employed, but we do not carry medical insurance. And for us to pay for the surgeries that needed to be done in the United States would be a minimum of $160,000. And we don't have that kind of money in a savings account. And so I put it off for so long because I just wasn't thinking of anything other than getting it done in the United States. And until my daughter convinced me to look outside of the United States. And when I did, I came across Dr. Venkatachalam's name through a video that I'm not even sure how it was linked to, because India was not the first thing I thought of. And when I found the one video, I was intrigued by his success with the patient. And so I started researching more and more videos, and I researched Dr. Venkatachalam's education, which was very important to me, and his success rate with his patients, and the fact that he used the Smith & Nephew Varolast knee, which was the one I had personally decided I wanted because I didn't want to have the surgery more than once in my lifetime. I want to have it once, and I want to be good for many years. The doctor was the reason I chose India. The doctor was the reason I chose the hospital. To me, the hospital is not as important as the doctor, but I knew that Dr. Venkatachalam would not perform surgeries in a hospital that wasn't excellent. And so I had confidence in him for choosing the hospital. When I landed in India, it was hot and I was in pain, but I was rested because I had slept on the flight over. The next morning I came to the hospital and met the doctor in person for the first time. And after you examined me, I had many testings done, which I didn't realize it was even going to be done, but I'm thankful because I think that it's important that you care for not just the knee, you cared for the whole body. You wanted to make sure I was physically in good condition to undergo the surgeries and the recuperation. So I went through the testings, and the next day I met with you, and you said I was okay for surgery, and I was admitted that afternoon, and knee number 1 was done 2 days after I landed in India. So I was thrilled. Of course, when I woke up from surgery, I didn't feel any pain, but then for a little bit afterwards, I had a slight amount of pain, but everybody kept asking me if I was in pain, and I really wasn't. I had been in so much pain before the surgery that the pain after the surgery wasn't anything near. So my experience at the hospital and with the doctor and all of the people who cared for me was much better than I had even hoped for, much better than what I had expected even in the United States. 5 days later, my next knee was done, and once again, I was amazed, and this time I was out of bed sooner than even the first surgery, and my mind at first said, how can I stand on two knees that are not my unoperated knees? But amazingly I did, and I walked, and I have just gotten better day by day. 5 days later, from the second knee, I was released from the hospital and have been walking without a walker, and I am doing steps, and I am taking care of myself. I don't have to have somebody get me a drink when I need a drink anymore. I can cook my own breakfast standing at the stove. To me, I'm still healing, but my life is coming back again. As soon as I was released from the hospital, Dr. Venkatachalam engaged a physiotherapist to come to the house every day for me to work with me. She comes each day and does exercises with my legs to strengthen my muscles, to stretch my legs, to stretch my muscles, and we have increased the intensity from the very first day to now. I'm doing steps now with her every day. More steps every day, and we do standing exercises and leg lifting exercises, and I do them on my own, not just when she's there. She assigns me my homework, and I do it after she leaves a minimum of 3 more times each day. And then after she leaves, the best thing is she ices my legs down because she's worked my muscles so hard. And I enjoy that. And even when I go to the United States, I will continue physiotherapy and on my own, because she will give me the exercises to do. And she said to continue keeping the full range, I will always need to exercise at minimum of 1 time a day to keep my physio strong. Before surgery, my right leg was set at a permanent bend of 15 degrees. It never would go straight. And I could only bend it about 90 degrees, maybe 90 degrees. So I could sit in a chair, but I couldn't squat to get in the cupboards or anything else or reach something low on the ground. My right leg would go straight, but it would still, or left leg would still go straight, but it would still only bend to a 90 degree. They are now able both to go completely straight, and they both are over 100 degrees, 110 degrees already. And I will probably gain up to about 137 degrees, which will allow me to completely squat down to the floor. The knee I wear in both of my legs now is a Smith & Nephew Verilast knee. It is a 30 to 35 year knee. It will be the only knee I ever have again. It is oxinium, zirconium, and stuff that's not going to wear out. I don't know what this stuff is called, but it moves, it bends, and it's going to last the rest of my life, and I'm going to be able to do this again and forever. Okay, this is my right leg, the first leg to be done. It is, I joke that I'm going to become a leg model because I think the scar is going to become invisible over a period of time. It's probably the most beautiful scar I've ever seen because these scars mean that I can walk straight, I can bend back more than 90 degrees, under, straight, and back. So you can see me go nice and straight, nice and bent back, which the chair legs gets in the way. So straight So my experience at the hospital and with the doctor and all of the people who cared for me was much better than I had even hoped for, much better than what I had expected even in the United States. From the time I was admitted, the staff was wonderful to me. Every doctor I encountered, from the anesthesiologist to the cardiologist who did my pre-testing to the nephrologist who I got to meet, everybody was very nice to me. They were friendly. They cared for me as a whole person. They didn't just care about the little thing that they would treat. They cared about me as a person. And I truly believe that that far exceeded what I may have expected even in the United States. The nursing staff was phenomenal. They wanted to make me comfortable every way that they could. Even the cleaning staff was just phenomenal. They would come in to sweep my room and they would ask me how I am. And they would ask me how my daughter and grandchild were who came to care for me while I was in India. And that's not something you find often in the United States in healthcare. When I go back to the States, I won't go back for a few more weeks to the United States, and school will have already started for this year. But I will continue looking for open teaching positions now that I'm able to stand, and I am hoping that maybe I can go back for a couple of more years, 5-10 years maybe, and teach and enjoy my profession again. So that will be very freeing to me. I would recommend that anybody that is looking for a knee replacement or a hip replacement or a shoulder replacement seriously look into Dr. Venkatachalam and come to Chennai, India for the surgery. The cost is so much less than America. You get to see another country and experience another culture. The care you will receive at the hospital is as good or better than you will receive in the United States. And you will still have some money to retire from when you're done.
Wow, it's so nice to see you walking around.
I've been walking.
How is the knee, the place that it was operated?
It's doing very well. You want to see?
Yeah.
Okay. This was the first one.
Uh-huh.
This is 2 weeks,